Good morning and welcome. My name is Natalie Hastings, and I will serve as your moderator today. Thank you for taking the time to be with us this morning. And we already have a question in the chat about will there be a recording made available? And yes, we will make a recording available after today's virtual press conference. We are so excited about sharing this updated United Way ALICE report with you this morning. And we're excited about the potential that this report offers to create a positive difference for many people here in Louisiana. This morning, you'll hear from a panel of 4 speakers. Sarah Berthelot, President and CEO of the Louisiana Association of United Ways. Patty Riddleberger, Vice President of Corporate Social Responsibility with Entergy, which sponsors the Louisiana ALICE report. Anisha Bradley, a teacher and mother of 2, who will be sharing the voice of ALICE with us. And Dr. Ashley Anglin, a researcher from the National United for ALICE team. In total, we expect the presentation to run about 35 minutes. Feel free to ask a question at any time in the Q&A. And include your name and media affiliation if applicable along with the question, just in case we need to do more follow-up. Once our speakers have finished, our panel will answer any questions that are raised in the Q&A. And we'll also continue to monitor the Q&A box until the end of our session today. All questions related to regional or local ALICE activities will be deferred to their respective United Way CEOs, who can speak to the specific regions served across this state. If you'd like to utilize any of the graphics that are shared during today's presentation, we will make those available to you as well upon request. Feel free to reach out directly in the Q&A or to my colleague, Joelle Poliski, at jpoliski@goshiftKey.com. Don't worry, we'll put that in the box as well. And like I said, use that Q&A box at any time this morning. We'll be monitoring. The press release that many of you received on May 9th to advertise this press conference includes regional CEO quotes and a list of media contacts for the CEOs involved in our press release. We will post a link to that original press release as well in the Q&A here just in a moment. And finally, if you would like to share on social media this morning while we are presenting in the press conference or with your stories, we encourage the use of #ALICE and #MeetAlice. Without further delay, please welcome Sarah Berthelot, the President and CEO of the Louisiana Association of United Ways, who is here to share with us.
Thank you, Natalie, and good morning, everyone. Thank you so much for joining us today for the press conference. Since 2016, United Ways throughout Louisiana have worked together to give an identity and voice to people who work hard yet struggle to make ends meet, people we call ALICE. The concept of ALICE is new for some members of the press today, so I'll take a moment to introduce ALICE. ALICE stands for Asset Limited Income Constrained Employed. We all know ALICE. ALICE is the hard worker who waits on our table, fixes our car, rings us up at the grocery store, serves in our classrooms, and cares for our elderly and young. ALICE earns more than the federal poverty level, however, not enough to meet a basic survival budget. This budget serves as an anchor for the ALICE measure for this report. Let's take a look at the updated budget released today. It helps us all to better understand ALICE. The household budget includes essentials such as housing, childcare, food, transportation, healthcare, and technology. This budget reflects only the necessities. It does not include discretionary items such as gifts, saving for a college fund, dining out, haircuts, and unexpected events as common as replacing a flat tire. You'll see that for a single adult in Louisiana to afford the basics, one needs to earn $26,760 annually, or a little over $13 an hour full-time. A family of four with two small children need to earn $66,288 to cover the family basics. This total income factors in child tax credits, and dependent care tax credits, which help to mitigate against rising family expenses in 2021. These expenses increased 11% from 2019 to 2021, reflected most acutely in child care, food, and housing costs. Again, this year, we offer a budget for seniors living alone, totaling $30,384 annually. Expenses for seniors increased 10% from 2019 to 2021, as many were driven to retire earlier than expected during this period. These annual amounts exceed the federal poverty income threshold in every family category. The federal poverty threshold for a single adult, including a senior, is $12,140. For a family of four, it's $25,100. Here's where you find Alice, working hard, earning above the federal poverty level, but below these basic survival budgets calculated for family size and location. Before moving on, let's consider a scenario for the most common worker in Louisiana, the cashier. The cashier earns an average hourly wage of $9.83, short of the $13.38 hourly wage needed to make ends meet for an individual. If the cashier is only working one full-time job, this worker will be required to choose between basic necessities or incur debt in order to meet these needs. Imagine the cashier with two young children that are needing childcare. Imagine the challenges of facing the monthly expenses of maintaining childcare on a cashier's wage. On that note, let's talk quickly about childcare. It's so important. Alice families with children face increased challenges in affording quality childcare, with childcare costs rising to more than $1,400 a month for two young children. This cost represents the largest expense for families needing to access childcare. In Louisiana, federal funding helped to expand the number of children accessing quality childcare through the Child Care Assistance Program over the last year. Today, up to 16,000 children and their working parents are at risk of losing assistance, which enables so much access for Alice families. The outcome of this rests in the decisions that are being made right now by our state legislators this week in the days ahead at the state capitol as the 2024 state general budget is determined. Today's report, Alice and the Cross Currents, COVID and Financial Hardship in Louisiana, is the fifth report for Louisiana and leverages 2021 public data sources. The research details the impact of competing economic forces and public policy interventions during the pandemic. And in Louisiana, we add on to that this series of devastating natural disasters that impacted nearly every community in our state. This report confirms that in 2021, more than 562,000 Louisiana households were Alice, a near record high at 32% of all households in Louisiana. When we factor in the 19% of households living in poverty, 51% of all Louisiana households were living below the Alice threshold, unable to make ends meet with their earnings despite disaster aid assistance in 2021. As the pandemic and disaster recovery aid conclude, this report points to the warning signs of the harsh challenges ahead for Alice, ranging from affording childcare in order to maintain a job, to difficulty paying bills and addressing basic medical needs. When it comes to the percentage of families living below the Alice threshold, Louisiana ranks second in the United States, only after Mississippi. Today's release joins a series of Louisiana-specific research-based reports made possible by the Entergy Corporation and United Ways across Louisiana in partnership with United for Alice. Entergy has served as the Louisiana state sponsor since this work began for Louisiana. It is my honor to introduce Patty Riddleberger as she shares a statement from Entergy. Patty serves as the Vice President of Corporate Social Responsibility for this Fortune 500 company. In this role, she develops customer service responsibility strategies that strengthen stakeholder relationships and create sustainable value for Entergy, its 14,000 employees and 2.8 million customers, and communities across the Southeast and Northeast United States. Patty, we thank you and we welcome you to share a few words.
Good morning. Thank you, Sarah. Thank you for the opportunity to be here and to spend some time with you talking about the state of Alice families in Louisiana. Entergy has been proud to have been able to partner with the Louisiana Association of United Ways to produce the Alice Report since its inception in 2016, as you just mentioned, Sarah. And we're happy to have seen how the Alice Report has come so far in the 8 years that it has been in existence. It's been instrumental in helping community leaders develop initiatives and programs that help lift up Alice families. And it's also played a critical role in helping our elected leaders shape public policy that impacts the lives of thousands of households that are struggling to survive. Just as you mentioned that our legislators are currently evaluating policies that could impact 16,000 families and their ability to access child care here in Louisiana. The Alice Report is critical in providing context for those types of decisions. And the reports also become a tool that businesses can use to help guide them in providing better services to Alice families. And we know that firsthand at Entergy because we used the Alice Report last year to help us develop the Entergy Bill Help for Alice program that helped to provide $4.4 million in emergency utility assistance for households that were struggling with their energy bills during the crisis last summer. With help from United Way partners across the state, we were able to provide assistance for 27,000 Alice families in Louisiana. Would never have been possible without the assistance of our United Way partners. And I want to take a moment right now to thank you all from the bottom of our heart for being our partner in that time. At Entergy, our focus on Alice is rooted in the economic reality of the communities that we serve. You mentioned just now that Louisiana ranked second in the number of Alice households, only to Mississippi, which was first, and Mississippi is also served by Entergy. So these are our communities, these are our customers. For more than 20 years, we've been focused on helping to address the needs of Alice and all of our customers who struggle from paycheck to paycheck. We work with our regulators to focus on actions that we can take to reduce the energy burden of low-income households through programs like energy efficiency, programs that help low-income households manage their bills. And then we also work with local, state, and federal agencies to maximize the flow of bill payment assistance. But we don't stop there. We really approach it from a holistic standpoint, and we work with community partners to help Alice families achieve long-term economic stability through programs like workforce training and job placement assistance, financial literacy coaching, and child care assistance. But probably the most impactful initiatives that we are able to work on would be our partnership with the IRS and United Ways in Louisiana to provide free tax preparation services for Louisiana Alice workers so that they can access tax credits to support their families and help address some of the challenges that they face. Through this partnership, we've been able to put $4 million in EITC refunds back into the pockets of low-income households in Louisiana just this year alone. And we've been doing this for 20 years, and we plan to continue this critical work. So these are just a few examples of the ways that Entergy demonstrates its deep commitment to equipping Alice families with the tools to be successful, while also inspiring action from businesses, policymakers, and communities to build stronger financial stability for hardworking Alice families throughout Louisiana. Because when Alice succeeds, we all succeed. Thank you for this opportunity.
Thank you, Patty, and thank you for your partnership and everyone at Entergy for this work together. We also are grateful for you, Patty, for serving as a member of the Louisiana Research Advisory Committee. And on that note, I'd like to recognize the 22 members of the Louisiana Research Advisory Committee for your service to this project. These volunteers from all regions of our state contribute their expertise and serve as champions for ALICE year-round. We thank these research advisory members for all of their help and support. This report is timely as we look beyond the pandemic and the disaster eras that we've all endured. And we look ahead at our work to address the most urgent problems facing our communities today. Understanding these persistent challenges for families and what it takes for them to meet their needs is critical as we move forward in our state's recovery. And most certainly, the economic scars of the recent years are visible with the data in this report. With an inability to get ahead or build assets, ALICE is just one emergency away from spiraling into a financial crisis. Prior to the pandemic and the series of natural disasters, 37% of ALICE had a backup savings to navigate emergencies. Fast forward to now, even fewer families and even fewer ALICE families are equipped with an emergency savings. In 2021, the percentage of ALICE families with savings landed at only 29%, compared to those earning above the ALICE threshold at 73%. The job interruptions, rising inflation, and the disaster losses have pressed hard against ALICE over the past 3 years. Many families are moving on. I know we are all ready to move on from the pandemic, but for ALICE, moving forward may be more challenging as temporary benefits expire. United Ways throughout Louisiana clearly see the plight of ALICE and work to provide programs and solutions to help. Entergy is one of our most valued partners in that work. Patty mentioned some of the work. This past tax season, United Ways helped thousands of workers access free tax preparation through volunteer income tax assistance efforts. Families drew down on millions of working tax credits, which helped build financial stability while supporting our local economy, and Entergy helped to make that possible. United Ways are found working in hurricane, tornado, and flood recovery zones during times of emergency, helping ALICE during those moments and helping them to rebuild their lives. United Ways advocate for increased funding for childcare for ALICE children and their working parents. And of course, United Ways support, and some even provide, Louisiana 211 services, which has helped more than 600,000 Louisiana neighbors meet 850 identified needs over the last 3 years alone. These are just a few examples on how United Way provides solutions for ALICE. I encourage members of the media to connect with your local United Way to learn more about the wonderful work designed to help ALICE in your communities. I'd like to now turn it back over to Natalie to introduce our next very special speaker.
Thank you, Sarah. Today, you have the opportunity to hear directly from ALICE. It is an honor to introduce Anisha Bradley, a mother of 2 from Baton Rouge. Anisha has risen from daycare teacher to paraprofessional to full-time elementary school teacher, and she's now a homeowner. Despite all of this success, she continues to face tough choices to make sure that her bills are paid and that her family is provided for. Anisha's can-do spirit and emphasis on teaching her kids important lessons will be sure to inspire you this morning, as it has me. Here is Anisha Bradley.
Good morning, everyone. My name is Anisha Bradley. I am a school teacher in Baton Rouge area and a mother of 2 great kids, Amaya, who is 13, and Antonio, who is 12. I am ALICE. Today, I own my own house and I've paid off tuition for my teacher certification. I went from being a daycare teacher to a paraprofessional to a full-time teacher. I already had a college degree. Before I made changes, I used to have to take out loans to get me through, and I would pay them off with my tax rebate. Even now, as a teacher and homeowner, it's still hard when I have to say no, I do, or I pay a bill late. I don't qualify for assistance because I'm right above the annual salary, and it's okay. I don't like asking for help. I have known people who prefer to work part time in order to assess assistance, but that's not the path I wanted for myself or my kids. To have the ability to make a better living for myself, I had to prioritize. I was working, raising kids, and paying for my own teaching certification. To do this, I had to prioritize. And a lot of people weren't raised with that type of thinking. To look at everything and think, how am I going to make this happen? I'm here today to speak to you because I want people to know that the cost of living is changing. And unfortunately, the pay is not. Even though, yes, I have improved in my career goals and have the ability to make a better living for myself, it still presents a challenge. Eventually, I will see the rewards of my labor, but the transition to improve is hard, and not everyone is taught how to prioritize money or improve their credit score. I'm practical. One paycheck each month goes mostly to my mortgage. The other paycheck is for the light bill, car insurance, life insurance, food, and to pay off a few things I needed to improve in the house after I bought it. My kids' health insurance is through Medicaid. I can't afford to put them on the school's insurance. I don't have a fancy car after my car was ruined in a great flood of 2016. I went without a car for a while and then eventually used the payment from the insurance in order to purchase a car in cash. That way, I have no car payment, only car insurance. I teach my kids about saving and spending wisely, as my aunt taught me when I was a teenager. If they receive a gift for a birthday, I let them spend some, but the rest is savings. My son Antonio developed food allergies. He can't eat many fruits and vegetables raw. They have to be cooked. He also liked to get food from a restaurant. One month, when we didn't have money left in the food budget, he asked me if he could use his savings to order food. I say no. That's not what savings is for. Go defrost something to eat. Amaya, develop a passion for gardening thanks to the Black Family Initiative. I found out about them during the pandemic when they offer online tutoring. Amaya, who struggles to focus and be organized due to ADHD, now grows her own vegetables for her salad. Summer camp is too expensive. Thankfully, I discovered the Boys and Girls Club summer camp program that provides camp at a reduced rate. They partner with the YMCA to do field trips and teach life skills like healthy relationships. This year has been rough and a little tight, but I made it through. Praise God. Now I can start saving again. With my income, there is very little room for error or for an emergency. Everyone who has interacted with my children tell me how they are truly amazing kids, and I'm doing a great job with them. It makes me happy to know what I'm instilling in them shows when they're not around me. I constantly tell my children to always have integrity, which means doing the right thing even when no one is looking, because it's easy to do right when eyes are on you, and it's a lot harder to do right when it's just you. My goals for their future is for them to continue through the magnet program that they're in through high school and go to college. and not have children as I did in college. Explore the world and live and build their savings and get ready for what they want to be before they think about having a family. Education first, explore, live your life, then have children and settle down. It makes it a little easier not to have to worry about providing for your family or having to decide whether to pay a bill or buy food or get gas for the rest of the month. Some struggles are preventable. For the most part, if we consciously teach our children to always strive for the best, do your best no matter what. Just because your parents and family members are going down one route, you can always be better. Always try to be better. That's what I want for my children. Even though I'm doing better than my mother, I want them to do even better than me by being financially stable. Thank you. I am Alice.
Thank you, Anisha, for sharing your inspiring story. We are also grateful to the Scepter Foundation, which makes the Black Family Initiative program possible. The Scepter Foundation is a funded partner of the Capital Area United Way. And programs like the Black Family Initiative help Alice. Today, you heard how the initiative has provided support to Anisha's family and others like hers. Next, we'll hear from a member of the United for Alice national team, Dr. Ashley Anglin, who conducts research, writes reports, and supports the development of new Alice tools and collaborations. United for Alice is a grassroots movement of over 650 United Ways, covering 27 states and the District of Columbia, along with corporations and foundations, all using the same methodology in order to document financial need. Dr. Anglin is a community and cultural psychologist with a master's degree and a doctorate degree from the University of Hawaii at Manoa. She also holds graduate certificates in both public policy as well as executive philanthropy.
Thank you for the introduction. I'm honored to join you today and to highlight some of the new features of the 2023 Alice Report for Louisiana. But before I do that, I want to take a moment just to thank all of you for your commitment to Alice in Louisiana. United for Alice is a partnership, and our collaboration with United Ways, community organizations, businesses, research advisory committee members, press, and Alice households throughout the state is what has really brought this research to life. So thanks to each and every one of you. Earlier in the presentation, Sarah did a fantastic job sharing the fundamental measures of the Alice research, the household survival budget, and the number of Alice households in the state. Now we're going to dig a little deeper into the findings. In every state, at least 32%, nearly 1/3 of households could not afford the basics in 2021. Yet rates of financial hardship varied throughout the country, from less than 35% in Alaska, New Hampshire, North Dakota, Utah, Washington, Wisconsin, and Wyoming, to more than half in Louisiana and Mississippi. By region, rates were higher in the South at 45%, compared to the Midwest with the lowest rate at 37%. And as Sarah and others mentioned, Louisiana had the second highest rate of financial hardship in the country. This high rate of financial hardship has been a persistent issue within the state, with the number of Alice households climbing year after year since the Great Recession, except for a dip between 2018 and 2019 that corresponded with an increase in the number of households below the federal poverty level. And notably, the percentage of households struggling financially has remained at over 50%, over half, since 2016. Alice households exist across all ages, genders, races, ethnicities, and geographies. Yet some groups are disproportionately Alice as a result of systemic barriers to education, homeownership, healthcare, and financial health and wealth and savings, among other things. Taking a closer look at the demographics of struggling households in Louisiana, we can see that the impact of the pandemic's competing economic forces played out differently across groups. In many cases, the pandemic exposed and widened the gaps in rates of hardship by race and ethnicity, age, and household composition. In Louisiana in 2021, due to systemic inequities, Black and Hispanic households, young households, and single-parent households had the highest rates below the ALICE threshold, while white households, working-age households, and married parent households with children had the lowest rates below the threshold. For households that struggle to make ends meet across all demographic groups, the crux of the problem is a mismatch between earnings and the cost of basics. Despite an increase in the median wage among the 20 most common jobs in the state, by 2021, 75% of these 20 top jobs still paid less than $20 an hour. And due to wages that have stagnated for over a decade, many of these top jobs still had a substantial percentage of workers who were either ALICE or in poverty. For the most common occupation in the state, a cashier, the median wage increased by 6% to $9.86 per hour in 2021. Yet 61% of the nearly 60,000 cashiers in the state were still below the ALICE threshold. Of course, wages were only part of the story during the pandemic, with a wide variety of supports and disaster assistance also playing a large role. While ALICE households often earn too much to qualify for traditional forms of public assistance, nearly all ALICE households were eligible for pandemic assistance. From temporary expanded tax credits like the child tax credits to stimulus payments to rental assistance, these supports provided strong relief and mitigated the pandemic's negative financial impacts. Yet, even with these temporary supports, many ALICE households still did not reach financial stability. For a family with 2 kids and 2 adults in Louisiana, the household survival budget was $82,284 before tax credits in 2021. With 2 full-time workers in 2 of Louisiana's most common jobs, retail sales and cashier, and multiple pandemic supports, that family's income still fell short of the budget by nearly $18,000 for the year. Ultimately, direct support to households during the pandemic helped to cushion its negative financial impact, as things could have been worse for the struggling households. But with inflation on the rise and pandemic supports ended or waning, there are warning signs. According to the November 2022 Household Pulse Survey, 18% of respondents below the ALICE threshold in Louisiana reported that their households sometimes or often did not have enough food to eat in the prior 7 days. And that rate was higher at 24% for Black respondents below the threshold and 36% for respondents with disabilities below the threshold. Also in November 2022, 64% of households below the ALICE threshold were struggling to pay bills, and 17% of renters below the thresholds were not caught up on rent. Additionally, 20% of respondents below the threshold reported feeling anxious, nervous, or on edge nearly every day over the prior 2 weeks. And as Sarah mentioned, only 29% of Louisiana households below the threshold had emergency savings in that same year. Together, these warning signs leave a large percentage of Louisiana households struggling today and vulnerable to future crises. Yet, in the face of these warning signs, I'm hopeful, because every day I see the community stakeholders across Louisiana and across the broader United for ALICE network coming together to make a difference in the lives of ALICE households. And ALICE needs us to keep pushing forward. As you take next steps for ALICE, I encourage you to explore the interactive ALICE data on our website, to connect with your local United Way for support and volunteer opportunities, to explore ALICE data by legislative district and connect to your representatives, and to visit at the ALICE in Action database to see what our partners across the country are doing to make a difference. So thank you all for your time today. And with that, I'm going to turn it back to Sarah Berthelot.
Thank you, Dr. Anglin, for all of your work in Louisiana. Dr. Anglin will be available at the end of this press conference to take any questions. As a final note, I want to thank the media for your attendance today and your concern for ALICE. We are grateful for the media coverage and again, encourage you to connect in with your local United Way to discuss work for ALICE in your local communities. The United Ways working hard for ALICE include the Capital Area United Way based in Baton Rouge and led by George Bell, St. John United Way based in LaPlace led by Dolores Montz, United Way of Acadiana, based in Lafayette, led by Heather Blanchard. United Way of Central Louisiana, based in Alexandria, led by Michelle Pearl. United Way of Northeast Louisiana, based in Monroe, led by Janet Durden. United Way of Northwest Louisiana, based in Shreveport, led by Latoria Thomas. United Way of St. Charles, based in Luling, led by John Diaz. St. Landry Evangeline United Way, based in Opelousas, led by Ginger LeCompte. United Way of Southeast Louisiana, based in New Orleans, led by Michael Williamson, and the United Way of Southwest Louisiana, based in Lake Charles, led by Denise Durrell. Starting today, Alice and the Cross Currents, COVID and Financial Hardship in Louisiana can be found at launitedway.org, at United Way websites throughout Louisiana, and of course at unitedforalice.org. Thank you all for your attendance for today's press conference and your partnership for Alice. I now turn it back over to our moderator, Natalie Hastings.
Thank you, Sarah. And before we get to questions, I just wanted to offer a few reminders. Individual interviews with today's speakers and regional United Ways can be arranged for you. And the graphics used in today's PowerPoint or in the report itself are available upon request. You can also view select media and the 2 press releases, so the press release that's being issued today, as well as the one from May 9th, in our public media drive folder, which will go into the Q&A here in a moment. And if you haven't downloaded the report yet, just a reminder that you can get that at launitedway.org. We encourage the use of those hashtags, #Alice and #MeetAlice on social media. So if you have any questions, feel free to reach out now if you'd like to ask a question of a panelist, and we will be sure to answer those. Gonna give a minute just to see if anyone.
And I see a hand raised by an attendee. And so the attendee, if you have a question, if you could please place it into the chat or place it into the Q&A. We'd love to talk about your question. So any questions for the person that had your hand raised? I may have figured out how to allow you to be heard if you want to raise your hand again. Be glad to help you.
And also just so folks know, Anisha, our Alice speaker, is also still on if someone has a question for her. And so looks like we have a few questions in the chat here, or in the Q&A here. The first question is from Whitney Thomas with Fox 44 News, who wants to know what you all are doing to hound in on the issue in Louisiana. How can families stay ahead beyond the economy?
Thank you, Whitney, for that question. I'm not sure there's a silver bullet for that answer. Of course, whenever we can help Alice build their workforce skills, and they can be employed and enter into a higher wage job, that's one of the ways that Alice can increase their income. And so we, United Ways and various groups support workers in enhancing their workforce skills. That's just one way. Another way is to ensure that Alice understands all of the forms of help that's available to them based on their needs, based on their location, And a way to do that is for anyone in Louisiana to dial 211 and share your need, share what you're looking for, and allow 211 to surface up solutions, services, programs, whether it be community-based programs in the place that you live, or government-based type programs that provide forms of help, like the Child Care Assistance Program, that could help working parents who walk a very tight tightrope financially to make it all work. Child care assistance can really be a solution to help meet other needs, while parents have the peace of mind knowing that their children are accessing care, safety, early education, so they can work. So being aware, so in summary, a worker seeking opportunities to increase their work skills is one way. And there's many ways that what comes to mind. And then also ensuring that that family, that individual is aware of all the forms of help that's available to help the choices not be so difficult to receive the benefits of the forms of help that's around. I'd like to open up and see if Dr. Anglin has additional insights to share.
Yeah, I wanted to just share that we do have on our United for Alice website, our Alice in Action database, which you can go to www.unitedforalice.org/alice-in-action. But what we're really trying to do is pull some of those best practices from across our partner network. And so I think there's a lot of things that folks are doing, from direct support, like some of the programs that Sarah mentioned, to some public policy and advocacy work to help put this data in the hands of policymakers who are making these decisions every day. But even the general public can have a role in that. So reaching out to your local representatives, sharing the data, sharing your perspective is a really important way all of us can get involved. Obviously volunteering your time as well and doing those types of things, but looking at those United Ways and other partner organizations who are doing work, whether that is through workforce development or whether that's through direct programs around housing assistance, whether that's in the construction and of affordable housing, whether that's looking at transportation solutions to cut down on those costs that Alice have every day kind of getting to work. And so there's, really looking at those different areas of our budget. There's always activities going on across those. So finding an area of interest, like I said, transportation, housing, childcare, food, all of those have direct support and programs that are currently in place in Louisiana and across the country to help these households. So look for those things that are most relevant to your interest, and you'll definitely find some either volunteer or direct support opportunities.
Thank you. Thank you. Very helpful. Okay, so looking at the next question, have there been any public policy changes that have made being in the Alice population easier or more difficult recently? That's an ongoing question. Anytime we have policymakers that are taking action that impact people's lives, they're taking action that highly impact Alice. And so we heard from our presentation that there were some positive policy actions that were made during the pandemic and natural disaster times, tax credits that helped families with children that greatly mitigated against the challenges of the pandemic, the economic shutdowns. We also benefited from forms of disaster aid in 2021. Those are two examples. Right now, we mentioned it in the press conference that the expansion of child care assistance as a result of federal funding last year greatly benefited Alice workers. Right now, as part of the legislative session, lawmakers are determining the amount of funding that can be placed into child care assistance in the 2024 state general fund budget. In order to sustain the federal, the child care assistance slots that were made possible through federal funding, the state has to maintain those seats, and they may not be able to. It's in the hands of our legislators. The governor's budget proposed $52 million as part of new general state dollars to help save about 4,000 of those childcare seats. Right now, those funds have been removed from the current budget of consideration, and our House Senate Finance Committee and our House Appropriations Committee is discerning the fate of those funds. And so advocates as part of the Ready Louisiana Coalition and United Ways, lots of people are reaching out to their Senate Finance Committee members and their House Appropriation members right now to communicate the importance and to urge lawmakers to do all they can to save these childcare seats, which will impact workers in Louisiana with young children that rely on this form of help to make their budget work. So that's just one example. Lastly, I'll just point out that the ALIS report through the years has been a good tool for policymakers to discern actions such as working tax credits, childcare tax credits, earned income tax credits, which all help ALIS workers get the tax credits they receive. Oftentimes they use these tax credits to pay down debt, pay tax refunds to pay down debt that accumulated over the course of the year. We have been told by lawmakers that the ALIS report is a valuable tool as each time they're asked to review these types of tax credits that impact families, the ALIS report is a tool that they use to make these decisions. Now, I will admit there's a lot of policy decisions that did not pan out, are not helping ALIS. And I think there is a ongoing dialogue around wage in Louisiana. There's an ongoing dialogue around teachers' pay. And so all of the decisions that affect people's lives ultimately affect ALIS. And so what we say is we encourage people to get to know the data, use it as a tool in decision making. Ideally, it's at the center of the table when these important dialogues happen. And we hope that ALIS, people like Anisha, who we heard from earlier, are visible to people that have a decision-making privilege. And so I'd like to ask any of my panelists if you have anything more you'd like to add.
Yeah, I think you really covered a lot of the key things. I just want to add that in, 2021, the year of this data, we saw that policymakers, local organizations, people took quick action, right, to step in because we saw a need and there was the pandemic and we knew that this was an unprecedented economic time. And it shows that, governments, policymakers can make those quick decisions with an engine that we often feel is really slow, right? So we can make those decisions. We can try new things. But keep in mind that those crises for ALIS might not be a pandemic. They might be a health issue. They might be a natural disaster. They might be a car breakdown. And so even though we have these kind of big moments that we all say, oh, we need to come together, ALIS has those moments every day. And so a lot of these policy decisions that we're making, we have to remember that this is the day in, day out for a lot of folks, not just a moment in time that we can say, oh, that happened and now we can move on. So we're really just encouraging not to go back to the status quo, but to keep pushing ahead for ALIS. And another way in terms of policy is to use the ALIS data to reconsider thresholds for eligibility for even traditional public assistance programs or direct assistance programs that organizations provide. A lot of those programs rely on the federal poverty level or multiples of the federal poverty level. And what this report really shows is that that's woefully inadequate when it comes to really understanding financial hardship. So if you can use better data to make those decisions, that means we're going to cover more people who need that assistance.
Thank you, Dr. Anglin. And just to reiterate, we encourage the media to reach out to your local United Ways. These questions that you're asking are very good, and our CEOs around the state could offer a very specific viewpoint from the communities they serve. So these are great questions. Thank you. Also, there's several of you that want to know, what can the general public do to help? And so, number one, we invite you to get to know this information, to understand it. If you're ALIS, we want you to feel like we hope that this data reflects Alice in the way that you relate to, and that we hope that it helps to communicate some of the challenges that you face. For me, whenever I first started to work with this project, I found myself wanting and watching and being more aware of the people around me and what they were doing to serve me, and being aware of maybe the challenges they were carrying that in a passing we didn't discuss. But this data helped me to understand the challenges that people carry in their lives every day, and it's all around me. And so I may be more aware and sensitive to, I am more sensitive to their needs, whether it be passing through the fast food drive-through and being served, or being served by a paraprofessional in a doctor's office. You can always connect with your local United Way for volunteer opportunities. There are many nonprofit organizations throughout Louisiana that are also champions for Alice. And we invite you to think about how you might want to serve your fellow neighbor, to make life easier, make life better. Almost anything you do to help your neighbor is helping Alice. And we also encourage you to share your story. If you're Alice, we invite you to share your story. It helps us to better understand your challenges. And at the end of the day, what we're all trying to do is better understand the challenges that people face so that we can shape solutions that really help. And so thank you for that question. And we'd love to hear from you at any time if you have ideas. Have these reports, Aiden asked, have these reports helped to shape some of the previous legislation and inform previous legislative sessions? And so just to go back to policy, there was a year where many of our tax credits that affected working families were specifically reviewed by our Senate and Senate Finance Committee. And this report was a tool that helped the committee that was charged with the review of understanding how these tax credits would, or lack thereof, would impact Alice. And it was a positive, there was a positive outcome. The tax credits were conserved, and it was cited that this report was a very effective tool. And some legislators have said it's the best tool. It's the most valuable tool for them as they make decisions about people's lives in Louisiana. And one of the reasons why it's so helpful to our policymakers is that the data provides state averages, which we discussed today, but it also provides hyperlocal data that go down to the parish and even the municipality, to the smallest of communities. And so those that are making decisions about others or curious about communities, the levels of data in this report go from the state all the way down to the most small communities in Louisiana. And that's what makes it very helpful. Dr. England, do you have anything to add to that?
No, I think you really covered it. I think it's the advocacy piece is people want better data to make decisions. And when you can see how many people would be impacted by a policy change and really look at those thresholds against budgets, you're not making theoretical decisions. You're looking at it based on really good estimates of what it's like on the ground. And we also, by looking at things over time, we can see the impact of some of those, economic changes. And so, yeah, across the country, we're putting this in the hands of folks making those differences. An example in Tennessee was there was a lot of additional funding, pandemic funding that hadn't been spent. And the United Ways in Tennessee came together to say, we can help get that out now. We know the need. We have the Alice data. Here's where we're going to be putting that in the hands of households. And the legislator said, great. Like, that's what we needed, was that next step to say who can get it out and who needs it. And this report gave them kind of both of those things. And so I think there's opportunities like that to really leverage it, especially when there's those questions of what should we keep? What should we add? What are those review processes that Sarah was talking about? This is when you really need that data in the hands of those legislators. So we've seen some success in the past across the country. We're looking for more as we move forward. But yeah, it's a helpful tool for that. We also have our legislative district tool on our site. which is unitedforalice.org/legislative-district-tool, where you can get the data by congressional district, as well as by state upper and lower chambers. So that helps too, to kind of package it in that perspective of what those policymakers, for the constituents they serve directly.
Thank you. And I think our last question is from Adam Daigle, wanting to on the topic of childcare, can we shed more light on what's going on there? It sounds like the cost is going up. Many childcare agencies have closed since the pandemic. What kind of challenges are happening? There's a lot of challenges. I'm not sure. I would not describe myself as an expert in what is going on with childcare, but I can definitely connect you, Adam, with someone who could really provide deep expertise around this topic. And that would be the Louisiana Policy Institute for Children. Dr. Libby Saunier would be someone that I think could really help us with this question. But we know that during the pandemic, there was, during the isolation and the shutdown, it was really tough for childcare centers to abruptly close down a small business. That was really tough for both the business owner, the childcare business owner, and the employees. And so there was a loss of childcare simply because of what was going on throughout our country and in Louisiana. The one thing that you can say is once the federal funding came down and offered the increased funding for childcare slots, our childcare industry rose to that occasion and was able to provide the capacity to provide parents with those slots. And of course, there's a waiting list for this type of assistance today. But so often one might have thought that if we got increased childcare assistance, there wouldn't be the capacity to be able to provide for those slots. And with the increased federal funding, we saw that there was capacity and that our childcare business sector were able to meet those needs. And so the rising cost is likely to do with the inflation that is affecting cost for so many things, but it may have a little bit to do also with the economic, just by the activity over the past several years. But I would, if you would like to talk to someone that really has studied these issues continuously and has an expert level knowledge of that, we can definitely connect you.
Yeah, and just one thing to add to that is we know that, ALICE childcare workers are the workforce beyond the workforce, but they're often ALICE themselves. And so those childcare, especially those home-based family childcare centers, which is the cost we use in our report, those are workers who are, working from their homes. They're often not paying themselves enough in wages. They're just covering their costs to be able to take care of children. During the pandemic, we saw them take on a lot of that burden personally because they didn't want to turn families away, right? But those workers themselves are ALICE. And so it's kind of a catch-22 because, it's hard to charge less when you need that money, but you want to do that, but you're also not getting the support you need. So it's can be a really sticky situation when you have a lot of people who want to take care of kids, who have those skills, but just can't make it with that low wage. And so it's really a two-pronged thing. It needs to be affordable for parents, but it also needs to be a business that can flourish for those family childcare providers too.
So last call for any questions. We've really enjoyed our time with you. We thank you for your attentiveness and being with us today. We had over 30 media outlets request embargoed access to the ALICE report to prepare for the release of the data today. We thank you for that. We welcome you to be in touch with us, whether it be later today or in the coming time, to talk more. Any opportunity to raise awareness around ALICE, we want to work with our media partners on that. And we thank you for your questions. Last call for any questions or needs on how we can help you before we adjourn the press conference.
All right. Thank you, everyone, for joining us today. And as a reminder, if you have additional questions related to the report or to getting connected to a local regional United Way, feel free to reach out to my colleague, Joelle Poliski, and her email is J Polisky, Polisky, at GoShiftKey.com. So it's JPOLISKY at GoShiftKey.com. And thank you so much. We've really enjoyed being with you this morning and getting your questions.